Welcome, everyone. Hi, I'm Sarah Narendorf. I'm Associate Professor and Associate Dean for Research at the Graduate College of Social Work at the University of Houston. I'm excited to welcome you today to first in what we're hoping will be a biannual series of webinars on bringing research and connecting it to practice, specifically around youth and young adult homelessness. We're a group of researchers, a special interest group of the Society for Social Work and Research. Coming together, we are all researchers who are very interested in connecting our work back to practice and to really hearing and learning from practitioners about what they want to know and need to know. So our webinar today is on housing access for young adults experiencing homelessness. So we have a lineup today of 4 different presentations that will take up the first hour, and then the last 30 minutes will be a Q&A. So encourage you to post your questions as we go along in the chat, and we'll come back and have a conversation about and answer those questions at the end of the webinar. We are offering CEUs today, and a link to the evaluation, which is the mechanism to get those CEUs, will be posted as soon as the Q&A comes. So look for that as we get about an hour in. Our first presentation is about what is different about housing for youth and young adults by Alex Wagaman and Dimitri Blair. Alex Wagaman is an associate professor at Virginia Commonwealth, and Dimitri Blair is a young leader and co-researcher. They have been working together as co-researchers since 2016 through Advocates for Richmond Youth. Our second presentation will be what is the role of COCs in the landscape of youth and young adult homelessness. That will be Amanda Akanian and Katie Welch, who are, Amanda is at the University of Texas at Arlington, and Katie is at the COC. She's the planning coordinator for Tarrant County. They'll be followed by a presentation on what do we know about triage tools by Eric Rice and Tony Cooper. Eric Rice is an associate professor at the University of Southern California. And Tony Cooper is the data and impact manager at My Friend's Place, a drop-in center for homeless youth in Los Angeles. And then we will wrap it up with a 4th presentation, who gets which type of housing and who is successful. That will be led by Shinta Shi and Mark Kirchhoff. Shinta is an associate professor at the University of Missouri with research focused on understanding housing disparities and health outcomes. And Mark is the program manager for the Flourish Initiative, a 501c3 in Columbia, Missouri, that provides emergency shelter and transitional shelter for unaccompanied youth. So that's our lineup for today. I see Alex and Dimitri are here ready to provide some framework for us on what's different about housing for youth and young adults. So I will hand it over to Alex and Dimitri.
Thank you, Sarah. Actually, Dimitri's going to kick us off. So as soon as our slide is up, we'll get started. And thank y'all for having us today. All right, I don't know if we can go back to slide 1. Awesome, thanks.
All right. Good afternoon, everyone. My name is Dimitri Blair, and I'm going to get us started by telling you a little bit about Advocates for Richmond Youth and the research we've conducted on youth and young adult homelessness. Advocates for Richmond Youth is a participatory action research team that was started in 2014 in Richmond, Virginia, to raise visibility and increase action around youth and young adult homelessness. Our team is made up of young people who use their lived experience expertise to determine what we should be researching and how. Since 2014, we've designed and conducted 6 research studies and used our research to develop trainings, engage in advocacy, and help design housing programs. Our team members are represented at the local, state, and national levels as leaders in the movement to end youth homelessness. What we're going to share with you today draws from our own research and lived experience, as well as from the literature that we have used to inform our work. Now I'm going to turn to Alex, who's going to talk about housing for youth and young adults.
Thanks, Dimitri. Next slide, please. So as Sarah said, we just want to talk a little bit about what we see as being different about housing for youth and young adults. To begin, we believe that housing specifically for young adults needs to acknowledge that youth and young adults have unique needs and experiences. Many of these may overlap with the needs and experiences of other age groups, but as we've learned through some of our national advocacy work, this isn't really about making the case that resources, which we know are already really scarce, be reallocated away from other age groups or populations. It's about building housing and housing solutions with the needs and experiences of youth and young adults in mind. We recognize that in many COCs or communities, having a whole separate youth and young adult service system or crisis response system is not feasible. However, we do believe that those COCs and communities can assess how youth affirming their service systems are and can make important changes to address the unique needs of young people. So what are a few things about these unique needs from a housing or housing program perspective? First of all, youth and young adults with histories of system involvement are overrepresented among youth experiencing homelessness. Young people coming out of or still connected to systems often have not been adequately prepared for adulthood and living independently. They likely have never lived independently. Young people may also have experienced harm from these systems, including schools, child welfare, juvenile and adult criminal justice systems, and that harm may impact their willingness to be involved in a housing or homeless service system. Because of these experiences, young people need flexible, youth-oriented options for how long they receive housing or rental assistance, or whether or not they're expected to live or manage a household on their own. Second, it's important to recognize the legal and structural constraints that limit young people's ability to get and keep housing. For example, up to 40% of youth and young adults experiencing homelessness are LGBTQ. LGBTQ people are not protected from housing and employment discrimination in all states. This is an important and legitimate concern for young adults who we may be trying to house. Similarly, based on our research, some LGBTQ young people will choose to stay in a potentially unsafe environment rather than seek services, housing, or shelter from an organization or program that is not actively and explicitly LGBTQ affirming. And third, Black and Latinx or Hispanic youth are also overrepresented among youth experiencing homelessness. Despite fair housing laws, we know that racism still plays a key role in a person's ability to access housing in the US. We also want to highlight that young people's homelessness looks different in that they might be accessing online supports or other networks for room or house sharing while in a housing crisis. LGBTQ youth, for example, seek housing support in spaces that feel trusted and where they can feel confident that they will be in safe and affirming places. In our community, we have an online social media-based network where young people will often post if they're looking for housing. This helps us to understand that housing programs and housing solutions for young adults really can consider how to maximize the resourcefulness and informal networks that young adults find and create by supporting these efforts to find housing rather than forcing a formal connection with a provider. And fourth, we want to highlight that adultism can be a barrier for providing housing and housing supports to youth and young adults. Many young adults have experiences with adults that have made them feel diminished or undermined in their ability to make decisions about their lives. These are obviously not the kinds of interactions that are going to foster a holistic housing plan that centers the needs of a youth or young adult. Based on our research, youth and young adults want housing program staff to be uniquely trained to refrain from engaging in adultist interactions, and housing policies that respect their autonomy. Peer support is a really important component of this. Now I'm going to turn it back over to Dimitri, who's going to talk about a holistic approach that meets youth and young adults' needs for getting and sustaining permanent housing. Next slide, please.
Thank you. While honoring choice and control, housing for young adults needs to provide access to services and supports that are oriented to where they are developmentally. And they need to be offered in a way that meets youth and young adults where they are. So, what does this look like? A few examples of this would be youth and young adults have had less time in the world to get things in place that are often needed to maintain stable housing. They haven't had a lot of time to learn how to find and access the resources they need. This means that when we take a housing first approach, we need to consider the developmental needs of youth when we set policies about things like how long a young person has to make a decision about engaging in services beyond housing or rental assistance. Youth and young adults need support developing a network of permanent connections or long-term supportive relationships. Our research shows that these permanent connections are vital to preventing future experiences of homelessness. They take time to nurture, and they come in the form of peers. They can come in the form of peers or adults. So when we think about youth and young adults developmentally, emerging adulthood as a developmental stage can be helpful in understanding the key developmental tasks that a young adult may be working toward and what wraparound services can assist with these. It is also important to recognize that there are things that affect what developmental task a youth or young adult might be working on. For example, some research suggests that LGBTQ youth and young adults may need space and time to explore key adolescent developmental tasks depending on when they come out and or transition. Another important consideration for housing-related services and supports is related to mental health. Research suggests that youth and young adults have different mental health needs and use different resources and strategies for their mental well-being. For example, young adults may be more likely to access technology-based therapy or other mental health resources. They also seek out peer-based therapy or support. Some of our research highlights how young adults seek emotional and social support from peers, especially if they're looking for identity-based support. The last point I want to make is about adultism. Alex has already talked about this, and I want to emphasize that adultism shows up in service delivery a lot. It can push young people away from the services and supports they need. Organizations serving youth and young adults should pay special attention to this through staff training and policy review. Thank you. And I am now going to pass it on to Amanda and Katie.
Okay, so it looks like I am unmuted and I've got our presentation showing. So thank you so much, Alex and Dimitri, for starting us off and for passing over the mic to me and Katie. So this section of the presentation is going to go over the role that COCs play in meeting the needs of youth and young adults experiencing homelessness. So I'm going to start us off by talking about what a COC is and what the research says about the implementation, barriers, and facilitators that COCs experience. Then Katie is going to talk about the organizational structure that her COC in Texas has used to strengthen its approaches to meeting the needs of youth and young adults. All right, so I don't have a ton of time to describe COCs in depth, so I'm just going to make this pretty brief. A continuum of care, or a COC, is geographically defined. So it's a geographically defined network of agencies that receives funding from the Department of Housing and Urban Development, aka HUD. COCs are tasked with a variety of things, but primarily administering federal homelessness and housing funds, conducting community-wide or regional planning, monitoring the impact of services on system-level outcomes, and the system-level outcomes are actually on the image on this slide, and developing what's called a coordinated entry system. So a coordinated entry system is essentially a standardized process for engaging, assessing, prioritizing, and matching service users into appropriate services and housing. So when we think about COCs and how they meet the needs of youth and young adults experiencing homelessness, I think it's really important to first acknowledge that COCs were designed to meet the needs of adults and families experiencing homelessness. The move toward thinking about youth, so under the age of 18, and young adults as individual or sort of separate developmental groups and need groups has really happened over the last several years. And so because COCs were initially focused on adults, expanding them to intentionally think about youth and young adults requires really diversifying member agencies and partnerships, which can yield to some complex intersector dynamics between systems that are not used to collaborating with each other. So for example, homeless service systems and foster systems. COCs also need to assess service gaps and capacity issues, which means navigating multiple funding streams, both within HUD and outside of HUD, because youth and young adult homeless services are funded in through a variety of mechanisms. And when we think about coordinated entry systems, they also need to be revamped for youth because they're traditionally designed to prioritize people who have complex histories, including disabilities and long histories of homelessness, which means they can easily deprioritize youth who are less likely to have those concerns. So there isn't a ton of research on continuums of care, and the research that does exist really isn't focused on youth. But I do think that from what's there, we can glean some insights into some of the barriers and the facilitators to success. Now, on this slide, I've grouped the barriers to success from the literature into a few different categories. And I'm not going to talk about all of these categories here today, but I just wanted to point out a few that I think are particularly relevant to what I was just talking about on the previous slide. So for COCs that are looking to expand or improve how they address youth and young adult homelessness, I think the barriers I've bolded on this slide are particularly relevant. So the need to identify service gaps, because those can be barriers. If you have inequitable attention to certain subpopulations, so not enough attention to youth and young adults, or within that, not enough attention to LGBTQ youth, for example, inefficient interagency communication, strained interorganizational relationships, balancing expectations from multiple funders, managing the competing demands of federal and local government agencies, and kind of community resistance or COC resistance to change or innovation. So on this slide, I've grouped the implementation facilitators into categories also. And again, I'll just highlight ones that I think are really relevant for thinking about COCs trying to expand and better meet the needs of youth and young adults. So again, I think the facilitators that I've highlighted on this slide are particularly important when thinking about how to overcome some of the challenges when you're trying to expand services and meet the needs of youth and young adults. So one is the need to do really good networking, right? So really build good relationships through your community and your member agencies. Another is to build positive relationships with local government, both at sort of municipal levels, but also at city and county levels. Engaging as many partners as possible. So again, really thinking about the broad diversity of stakeholders needed when you are starting to meet youth, to serve youth more expansively. And then collaborate. So the governance section is COC governance. So how COCs actually govern themselves. So having a collaborative governance structure with meaningful inclusion of providers. So not only including a lot of member agencies, but making sure that the providers within those agencies feel like they're part of the decision making. And then finally, and really I think most importantly when we're thinking about engagement, is intentionally involving consumers. So people with lived experience, and especially young people with lived experience, and not just as sort of tokenistic members, but really engaging them in decision-making and governance structures. So now it's my pleasure to introduce Katie Welch from the Tarrant County Homeless Coalition. And she's going to talk about her COC and its youth-focused organizational structures, which I think are kind of a nice illustration to some of the ideas that I've talked about here. And Katie, as you go, just give me a next slide instruction and I'll move forward for you.
Awesome. Thank you, Amanda. So hi, my name is Katie. I'm a planning coordinator at Tarrant County Homeless Coalition, which is the lead agency of the Texas 601 Continuum of Care, which we call a COC for short. So today I'm going to talk about how our local COC coordinates and works to improve the youth homeless services system across our local community. And then next slide, please. So first I wanted to give an overview of our COC as a whole. So we cover Tarrant and Parker counties, so 2 counties here in Texas. Our total population, of all people that live in these 2 counties, is about 2.2 million. And then our total number of people experiencing homelessness, so this is going to be all people regardless of age. So at a point in time in 2021, we had about 1,200 individuals experiencing homelessness on a single night. We have about 1,067 active households experiencing homelessness monthly, and then about 4,474 active households experiencing homelessness annually. And then, as I said a little bit earlier, Tarrant County Homeless Coalition acts as the lead agency. And so as the lead agency, what we do is we facilitate system-wide planning and collaboration among over 25 partner agencies. We collect and analyze system-level data, and then we also help to coordinate various funding streams across the community with the goal of ending homelessness here in Tarrant and Parker counties. So that's an overview of us. Next slide, please. So now I want to dive into youth specific. So while Tarrant County Homeless Coalition does work to coordinate the entire homeless services system, we also look at subpopulations specifically to ensure the system is working for different groups. So youth 24 and younger is one of the subpopulations, since youth homelessness can look different than other subpopulations, as our presenters earlier spoke about. So just to give you a cap of what our youth homelessness looks like. So monthly, so youth 18 to 24, we see about 129 individuals experiencing homelessness monthly. And then unaccompanied youth under 18, we see about 20 individuals monthly, making up a total of 149 individuals, 24 and under, experiencing homelessness monthly. And then annually, we have 494 individuals, 18 to 24, on average, about 140 individuals, unaccompanied youth under 18, making up a total of 634 youth experiencing homelessness annually. So that's kind of what our youth homelessness looks like in our community. Next slide, please. So Tarrant County Homeless Coalition facilitates the following 3 groups to coordinate and improve our community's youth homeless services system. So we have a youth committee. Our youth committee is made up of management level staff from partner agencies that work with and serve youth. We have about over 20 agencies represented on our youth committee, and this committee meets monthly. And then some examples are listed up here on the slide of the types of agencies we have represented on our youth committee. The second is what we call our youth case conferencing group. So this is going to be like case managers, street outreach workers, and other staff that work directly with youth experiencing homelessness. So this is our group of direct client service staff. And so they meet once a month as well, and they talk about client level issues, needs and gaps, how to overcome barriers for their specific clients. And then we also have our Youth Action Board, and our Youth Action Board is made up of youth 24 and under who are currently or have formerly experienced homelessness. Next slide, please. So here are some of the main benefits of having this particular organizational structure for our youth homeless services coordination. So the first being solution focused. So these 3 coordinating bodies on the previous slide, they've worked together to develop our community's strategic plan to end youth homelessness using real-time data, service provider feedback, and youth voice. Because of this diverse collaboration on this plan, Texas 601 has buy-in from our community leadership and direct service providers to ultimately be able to successfully implement this plan. This particular plan also provides specific data on the number of additional housing resources that our community needs in order to end youth homelessness and the steps in collaboration we need to take to achieve this goal. So that's been one of our biggest benefits from having this structure, is being able to create this tangible plan. The next is addressing system barriers and gaps. So these 3 groups have also been able to identify and address system barriers and gaps at both the management level and among a staff working directly with clients. And there's also a direct feedback loop between our youth committee and our youth case conferencings to help bridge the gap between management level and direct client service level staff. We have the third benefit is networking and problem solving. So this structure allows for networking and real-time problem solving among diverse service providers working directly with youth. And we'll get into some examples of that on the next slide of what that looks like. And then finally, youth voice. So we also make sure to incorporate youth with lived experience at all levels of planning and implementation. Service providers, both at the management level and at our direct client service level, receive real-time feedback from youth with lived experience. So next slide, please. Okay, so then we did want to go through some community examples of how these benefits we discussed on the last slide look in practice in our community. So starting with our youth committee, an action that's come out of our youth committee is that as they looked at system level data and talked about needs and gaps, they realized that there is a disconnect or gap between youth exiting our foster care system and between our youth homeless services system, especially for youth age 17 and 18. We also noticed as a community that many youth 18 to 24 who experience homelessness have past foster care experience. So the youth committee identified an opportunity to strengthen the connection between these 2 services systems and prioritize additional prevention and diversion efforts for youth exiting the foster care system. And because we had the local leadership from both of these systems of care in the room during our youth committee meetings, we've been able to discuss ways to actually bridge this gap in practice. So that's been a big benefit there. The second wanted to speak about was our youth case conferencing group. This is our group of direct client service staff. They meet twice a month, and they're able to solve problems in real time that ultimately lead to long-term system improvements. So an example being during case conferencings, typically the direct client service staff will talk about barriers they are facing as they help their clients to obtain housing. They identified that there is a need in our community for a one-stop shop for youth to be able to complete the steps necessary to access permanent housing. And because of this discussion, one of our service providers actually organized a youth wraparound services day at our local day shelter and invited multiple partner agencies to attend. And now, because of that, it now is actually occurring twice a month and is a consistent entry point for our youth to connect with our housing programs and our youth dedicated service providers. And this all stemmed from our youth case conferencing meeting. So that's another example of that networking piece in practice. And then third example we wanted to give was of our youth action board, which meets once a month, and we solicit feedback from this group with lived experience. They actually identified that there's a need for youth dedicated spaces, such as emergency shelter, and how many youth don't feel comfortable going to our adult shelters. And actually currently our community doesn't have a youth dedicated emergency shelter or youth dedicated space. So we were able to take this feedback from our youth action board when we shared it in our youth committee and our youth case conferencings, which has the leadership from these emergency shelters in it. They were able to hear this feedback from youth, and now they are actually discussing at the leadership level how we can make space in these existing shelters dedicated to youth so that they will feel more safe accessing these shelters. So that was a direct example coming from our youth action board. So those are the community examples we wanted to share with you guys today. I think our last slide here is our reference slide. So here's a list of references. And then now that we've talked a little bit about how COCs address youth homelessness, Eric Rice and Tony Cooper are going to talk about the triage tools for housing. Thank you, guys.
So there we go. It's a pleasure to be here with all of you today. This is one of my favorite things to do, that is to talk about research that is really targeting practice and to speak with practitioners about this. And I'm really honored to have Tony, who is a collaborator of mine for several years now, and who is actively working with me on a new project on Triage Tools in Los Angeles. She's a part of our community advisory board for that project. It's important to think about how it is that communities of care. So I guess I should really start by saying thank you to Katie and Amanda for setting us up. Within the context of youth homelessness, within communities of care, there are oftentimes what is referred to as coordinated entry systems that work specifically with youth. Sometimes these coordinated entry systems also must address family and single adult homelessness all at the same time. And one of the things that has been done over the last several years to help this process work is the creation and implementation of triage tools. So what is this triage tool business, right? Let me be less. There we go. All right. So a triage tool, what is it and why? It's intended to be a quick assessment that allows providers within the context of a COC to identify youth who might be at greatest need for housing. So the question really comes up, well, why do we need to bother with this? And I think it's important to understand the context of how these tools came about in the first place almost a decade ago, which is that prior to the advent of these tools, agencies outside of the context of a coordinated entry system were really allowed to house whomever they wanted with whatever criterion they wanted. And the research on this really showed that there was a lot of systemic racism and classism that pervaded those processes. So despite good intentions, oftentimes the folks who were provided with housing were people who looked white, talked white, acted white, and middle class, and also in the context of youth, middle-aged. right? And so when we're thinking about this, we as HUD and other lead agencies and thought leaders were trying to advocate for how to improve systems, the idea was we wanted to really address those who are the most in need for these tools. So not to cream the easiest to work with or the most biased choices, but really to work with those who are most in need. Now, what's complicated about this is that we can't just, as the last two presentations really suggest, we can't just import the adult tools, because youth really experience homelessness in a very different way. They're at a different developmental stage in their lives. Their histories and experiences at this young age that have led them to homelessness as young adults and youth are very different from those that, or can be very different at least, from those who experience homelessness at an older age. And the tools that were originally designed for adults, such as the VI SPDAT tool, were really intended to identify health risks. So really, making sure that people don't die prematurely on the streets, or to identify extensive health care and other system like jails and other institutions, those costs. Youth tend to be relatively healthier than adults, whether they're experiencing homelessness or not. And they also just don't incur as much system costs because they haven't been alive as long. So neither of those is appropriate. So starting back in 2012, I was working with some folks at CSH to develop a youth-specific tool. That research eventually was incorporated into OrgCode's work that they did on the TAE VI SPDAT, or the Next Step tool. And this is the tool that's used by the most frequently used tool in COCs across the country at this point. And it's not perfect, which is why we're doing this current research project to try to improve upon it. But and really what Tony's going to get to share with you is some of the problems that can happen, as well as some of the realities of what it's like to actually administer these tools with young people. But before I pass things over to her in about another minute and a half, I'm going to share with you all just a little bit about what's in these tools. So if you yourself haven't worked with them, you can understand the sorts of questions that these young people are being asked. So, and before I get to that, one of the things that happens with these tools is that they are scored. So you, at the end of taking this survey, you are scored between 1 and 17, and there are recommendations about what ought to happen to young people. So the idea is that the higher your score on these tools, the more vulnerable you are, and the more appropriate it is to give you the most resource-intensive services, especially permanent supportive housing options that are long-term housing with supportive services. The idea being that youth who score in a mid-range of this acuity could be given shorter-term housing, which oftentimes translates into rapid rehousing vouchers these days. And if you score very low, oftentimes young people are really offered diversion services, but not specific housing interventions. So that's what's done with these things. And so how does that actually play out? Well, there's a lot of questions that you're asked. And here's some examples of some of the questions that you may be asked. For example, do you have any planned activities other than just surviving that make you feel happy and fulfilled? If you say no, you get a point. Are you currently able to take care of your basic needs, etc.? If no, then a point. Other questions are grouped like these questions here. So, for example, does somebody trick you to do things that you don't want to do? If you answer that, you get a point. Or if you say, do you ever do things that you consider to be risky? And then there's a whole list of things like exchanging sex for money, running drugs for someone, having unprotected sex with someone that you don't know, sharing a needle, or anything else like that, then you get a point. So these are the sorts of sensitive questions that are asked of these young people in the context of this tool. And with that, I will turn things over to Tony, who will talk about what this actually looks like when you're working with young people.
So hello, everyone. Again, my name is Tony. I am the Data and Impact Manager at My Friend's Place, a crisis drop-in center in Hollywood, California. And as the data and impact manager, I do focus primarily on evaluation. But as a research practitioner in the past, I've also had the privilege of being a case manager and working directly with adults and administering the VI SPDAT. So a lot of what I'll talk about today is from my personal experience, as well as the experiences of housing case managers at my friend's place. And so to spice up the presentation a little bit, I thought we'd do a little bit of role playing, and I would take on the role of Kayla, a housing case manager at my friend's place. So allow me to reintroduce myself. My name is Kayla. I am the housing case manager at my friend's place. I am here to talk about some of my experiences with the Next Step tool. And I thought the best way to do that would be to share a story of a youth that I worked with in Access Center. Slide. Last spring, or it seems like it was last spring, but it was actually a few years ago, I was notified that Frankie was at my friend's place, and I was notified by our intake and crisis care specialist, Shelly. Our intake and crisis care specialists actually are the first people that will meet our youth. They acclimate the youth to the space, they introduce them, they will complete an intake with them, and then they will also just figure out what their needs are, and then they would triage them to other services at my friend's place. And so Shelly contacted me and just let me know that Frankie was in our space. Frankie was a youth that was heavily impacted by substances, was also really interested in housing. And so she thought this youth would be a really good fit for our housing case management, which is a more intensive program at my friend's place. One thing that I wanted to note is that there are primarily two ways that youth hear about my friend's place as an access center, and that's through LASA, who has a list of access centers that demarcate by SPA region, and then also through internal referrals. So that's another way that they also hear about Access Center and are referred to us. Slide. So there are typically 3 visits before we complete the Next Step tool with the youth. The first visit will complete our own Access Center intake. And this is just for us to get a little bit more information about the youth, their demographic information. And then the second visit, they'll tour my friend's place. We want to get them acclimated to the space. We want them to know what services we offer. And also we want to keep them engaged while they're waiting for housing. And then the third visit, they'll complete the Next Step tool. Slide. So for the first visit, I learned that Frankie actually goes by Francis. And Francis was really interested in housing, but he also struggled with substances. So with that first visit, I learned that he gets pretty irritable when I ask him a lot of questions, but he was able to complete the intake, and we're able to schedule his next visit where he would tour my friend's place. Slide. And so with this visit, this was the first time that he came to my friend's place without being impacted by substances. So I was able to introduce him to our safe haven counselors, which is our basic needs services, clothing, housing, clothing, showers, etc. Some of our basic needs, food, and then also our transformative education counselors, which is our creative arts programming, our employment and education services. The goal of this second visit is to make sure that the youth feels comfortable coming to our drop-in center space so that they can remain safe while they are on the streets. We can have harm reduction conversations with them. And we just want to make sure they're connected so that when they are matched to housing, they're able to fill out the paperwork. Slide. And so for our third visit, Francis unfortunately did come impacted by substances, and it was pretty hard for him to fill out the Next Step tool. So we had to split the Next Step tool into 5 sessions when typically it only takes 1 session to complete the Next Step tool. Slide. And so completing the Next Step tool with Francis was not the only struggle that I had. Another struggle that I had with Francis is that because he was impacted by substances, he was not really able to answer some of the questions accurately. So around his mental health, around his substance use, they did not accurately reflect his reality. And because of that, he was going to score lower on the Next Step tool and not be prioritized for permanent supportive housing. And we know that for him to have been successful, he really needed permanent supportive housing. And so I was really faced with this moral conundrum. Do I change his answers to demonstrate his vulnerability and his reality? Or do I leave it the same because this is a self-report assessment tool? And I decided to change his answers because I thought it was important for him to be successful and to be able to live his best possible life. And I thought the only way he would really be able to do that is if he was matched to permanent supportive housing. Slide. So it took about 4 or 5 months or so for Francis to be matched to housing. And during those 4 months, we tried our best to keep him engaged at my friend's place through our creative arts programming, through connection with our safe haven counselors. And we had many harm reduction conversations with him around his substance use. And this made it much easier for him to sign all his paperwork once he was matched to housing. You know, unfortunately, many of our youth fall away from services while they're waiting for housing because they lose hope. We tell youth when they first engage in this process that it can take about a year before they're matched to housing. And that's a pretty long time to be on the streets. And it's a pretty long time to remain hopeful. Slide. So Francis was housed for about 5 months when he was evicted from his housing. 6 months later, he turned 25 and transitioned to adult services. And so at this point, we referred him to an adult service provider that was very close to my friend's place. And while he scored high on the Next Step tool, he did not score high on the VI SPDAT, which is the adult triage tool. He did not score high because he did not have the chronicity or the physical health issues that older adults typically have, who are also competing for the adult resources, as Eric mentioned earlier. Slide. Because of this, Francis aged out of our TASE services because he turned 25. But he would still come and visit my friend's place sporadically. He would keep me updated on his life. He would grab some food, and we would also exchange needles and just make sure that he was being safe while using on the streets. Unfortunately, I learned that Francis died from an overdose 2 months after his 26th birthday. Slide. The last thoughts and the things that I would hope to leave with you from this presentation is that the Next Step tool has questions on physical disabilities that allow for observers to give input on the youth's physical health. We're hoping that possibly, as we're making iterations on the Next Step tool, that there could be questions that would allow observers to give input on a youth's mental health and substance use as well. If at all possible, the observer's input should also affect the overall score. This could help staff such as myself when we are faced with these moral conundrums of changing these answers on the Next Step tool. And then also one thing that I want to mention is that Francis is a fictional case study, but there are many youth who will go through services at my friend's place and have a similar unfortunate outcome as Francis. And so it's important that as we are, making iterations on the Next Step tool, that we keep these considerations in mind so that there are not several youth dying on the streets. Slide. Also, TAE who are 24 are of great risk because once they turn 25, they will no longer have access to age-appropriate services and housing. Depending on their physical health, they will most likely not score high on the VI SPDAT, as Eric mentioned earlier. The Next Step tool scoring should take into consideration how 24-year-olds are of greater risk to slip through the cracks and end up dying on the streets if they age out of TAE services. So thank you for this time. I think Eric has something he wants to say.
Oh, yes. I'd like to turn things over now to Shunta and Mark.
Okay, so hello everybody, my name is Shintashi, and me and my partner Mark is going to present the topic, who gets which type of housing and who is successful. Specifically, we're going to focus more on potential housing disparities that faced by youth experiencing homelessness. So based on the tools that Dr. Rice just introduced, the ideal situation is that people who are eligible for housing should have equal chance in terms of getting to housing, and people who received housing should have equal chance in terms of sustaining in housing. However, we heard community providers raising concerns regarding they have observed potential disparities on housing prioritization or housing sustainability based on race, ethnicity, gender identification, sexual orientation, and of course, rurality locations. So to answer those questions and to trying to explore whether there are disparities, we utilize the identified homeless management information system data, which I'm sure a lot of you may be already familiar with. We This data set covers 16 communities across the United States, including rural and urban communities, of course. And the information included in the data sets are demographics, responses to youth responses to next step tool items, their overall NST scores, which was used for their housing prioritization. We also have information regarding the time when they are assessed, the time when they exit homelessness, basically receiving permanent supportive housing or rapid housing programs. We also have information regarding what may be the time they return back to homelessness. And we're using this data set trying to understand what may be the factors associated with waiting time to get housing and their sustainability after they received housing, and to see whether there are disparities. So we didn't find much disparities when we're talking about permanent supportive housing in terms of waiting time and staying in permanent supportive housing. The most prominent factor or indicator to that is basically youth, their personal vulnerability. So basically, if youth are higher in terms of NST tool score, they wait shorter period of time to get into permanent supportive housing. However, they're also more likely to not sustain in permanent supportive housing and return back to homelessness. We did have some findings regarding potential disparities when we're focusing on rapid housing programs. So for waiting time, basically waiting time to get into rapid housing program, please interpret the y-axis as the chance of get into rapid housing program over time. And you can see based on the graph, it shows that minor youth, as compared the solid line, as compared to non-minor youth who are 18 or above, they have lower chance in getting into rapid housing program over time. So in other terms, they wait longer period of time to get into housing. So another disparity that we identify is rural versus urban. So again, the y-axis is the chance of getting into rapid housing over time. And the solid line is rural youth. And we can see that compared to the upper two lines, which are suburban youth and urban youth, we found that youth at rural area wait significantly longer period of time to get into rapid housing programs. So finally, for rapid housing waiting time disparities, we can see that the upper two lines are emergency shelters and transitional living programs. So we asked about, in the HMIS data, they asked about in the past 30 days, what may be the place that you spend most night with. And youth who said that they spend most night in emergency shelter and also in transitional living programs, as compared youth who we usually consider literal homeless, they are waiting shorter period of time to get into rapid housing programs. Now we're going to shift our gears to look at sustainability. So this time for the y-axis, please interpret it as the chance to return back to homelessness over time. So in this case, we did find racial disparities in terms of housing sustainability in rapid housing programs. Basically, the upper three lines are youth of color or racial minority youth. And as compared to their white peers, they actually have higher chance over time to return back to homelessness. In another way, they are less likely to sustain in rapid housing programs. And we also found interesting finding that as the upper two lines, which are youth who are couch surfing and also youth who are living in transitional living programs, they are having higher chance over time to return back to homelessness. When we're comparing to youth who are outdoors, youth who are emergency shelters, who also received rapid housing programs. So I'm going to, this is the slide that basically summarize all our findings, and I'm going to turn it to Mark, and he's going to provide insight from a community perspective.
Thanks, Shanta. So really, we're looking at rapid rehousing, and rapid rehousing is supposed to be pretty nimble. And we're looking at two different data sets here. We're talking about accessibility and we're talking about sustainability, and both those present unique challenges, and specifically unique challenges for youth. And the processes for obtaining rapid rehousing, which we've seen from the wait times, can be cumbersome, and that is even more so for youth. Next slide, please. So again, we're looking at minor versus non-minor, and the top line. So non-minors have a higher success rate of over time of gaining rapid rehousing. Next slide. So we're going to kind of look at some of the reasons for these. What are we seeing here? What's the data telling us? And maybe what are some explanations for it? So one is just a natural bias against leasing to youth that exists in many communities. This is not just for youth under the age of 18, so minors, but it's also transitional age youth. A lack of credit and rental history, lack of just documentation, a lack of long-term income can be detrimental. And many landlords are resistant to renting to youth for these reasons. Fewer access points for youth to engage in the coordinated entry process. A lot of rapid rehousing comes through our coordinated entry processes, and this has been identified in several of the presentations today. Our coordinated entries processes aren't necessarily set up for youth. So many communities have these funds, but few have youth-facing organizations that really interface with these dollars and provide access to them. We also have a lack of experience navigating these systems. Getting a lease is hard, and finding a place to live, and just getting the funding and signing the paperwork. So youth often have more immediate supports. It's more possible they self-resolve, and they're unfamiliar with long-term receiving these services. So that can definitely be a barrier. Next slide, please. So again, we're looking at rural versus urban and suburban youth and waiting times for rapid rehousing. And again, you can see kind of the trend is definitely up, but rural really sticks out. Rural youth really stick out in the less likely chance to get rapid rehousing. Next slide. So what are some reasons? One is just the lack of available housing in rural areas. Suburban and urban areas, Columbia, Missouri, where we operate is a college town. There's a lot of turnover. So there's apartments becoming vacant. So youth have opportunities, vouchers can be used. So there's just more possibilities. And so you have also a larger number of landlords. They're sometimes more willing to take a risk and as they perceive it and give a youth a chance at housing. So there's more availability, and then there's just more growth we've seen in urban areas and suburban areas, and that's changing a little bit just due to the housing market prices. But COVID has also exacerbated this situation just with with affordable housing in general. And there's a very real stigma that we need to think about when surrounding homelessness, especially in smaller and more close-knit communities and typically rural communities. If there's one high school, if there's, you see people have common jobs and meeting places, there's a very real stigma for youth to want to access services and to be admitting or saying that they're maybe using a voucher or they're in a program. So I love it that when we heard from Tony, just the fact that their drop-in center is named My Friend's Place. So a youth can say, where were you last night? And they can answer, I was at my friend's place. And that's just a little thing that organizations can do to help chip away at that stigma. And so a youth can feel more comfortable in accessing services, but we can get creative with it even more. Next slide. So let's go ahead and we're kind of looking at, it goes transitional, emergency shelter, vehicle, couch surfing, outdoors. So that's kind of our downward trend for chances of getting rapid rehousing. Next slide. So what are we seeing here? We're seeing support systems and resources are key. So consistent shelter, access to case management, both of which come typically in transitional living programs as well as in an emergency shelter. Those are extremely key in helping to just like to know about the rapid rehousing, to understand these systems. Reliable transportation, getting from place to place, going to look and talk to landlords. So you may be sleeping in your car, but that's an asset. That's a resource, something more so than maybe a youth that's sleeping outdoors or couch surfing. So this is some of the things that we're seeing, and that access to these resources and these support systems, whether it's friends, family, rides, all these things, are incredibly key to lowering those wait times and having more success at obtaining housing. And so it's also, as we said, those already accessing services are more likely to continue doing so. So if you've been through the system and you've signed up for a transitional living program, or you've gone through that and you kind of understand what that looks like, you're more likely to continue looking at programs such as rapid rehousing and going through that process, especially if you can stay engaged, considering what we've seen is the long wait times. So this is really a testament to the need for youth outreach and drop-in centers, meeting youth where they're at, inviting them in, having magnet events, things like that, to give them just a touch point so that we can really provide, just allow for them to come and see what is available, what's out there. And so that is very helpful. Next slide, please. So here we're getting into our sustainability. And this is, again, we talk about racial disparity and sustaining your housing. This is for rapid rehousing, but I have a feeling this would probably look fairly similar even just for regular housing in general. And so next slide. Some of these disparities, we look at fair housing practices in the market, and we kind of think about those disparities exist already. So even within our own systems and the systems that we're going to be acting with, those disparities exist, and they definitely negatively impact housing stability and sustainability. One of the first things we look at is eviction rates. Just in eviction rates, the data shows that eviction rates for people of color are much higher. And this is just generally, is something that we've experienced with youth that we've served as well. Landlords are just less likely, if somebody maybe doesn't follow their policies or their lease as much, or maybe misses a payment, the rates of eviction are just much higher for people of color. So that's a disparity that already exists within the housing systems. There's also systemic inequalities in our social institutions, less access to supportive services, education, living wage employment. All those have really important factors in not only sustaining your housing, but some upward mobility and being able to extract yourself from housing. So, and we have to look at the physical locations where we're placing people for rapid rehousing, where they're finding actual housing. Does it look like the environment they're familiar with? Is it a social and cultural, those structures in place that make them feel comfortable and add to their well-being? If they're not, then it's going to be particularly more vulnerable to losing and not retaining that housing. Next slide, please. So this is a really interesting slide for me. We'll kind of talk about, so we see transitional living program and couch surfing grouped up top. And that means that they're at a higher rate for returning to homelessness than the bottom two, which are exiting from outdoor situations and emergency shelters. Next slide. So this to me was really counterintuitive. I've operated a transitional living program, and I would like to think that when we allow youth to, be there and live independently, most TLPs are set up with independent living styles, really, working on life skills. We'd like to think that we're setting them up for better independent living. But really what we find here is that the data is showing us that that's not the case, that they're actually more likely to return to homeless after exiting a transitional living program. That was incredibly not what I expected. And I'm kind of, this is kind of an open-ended question I think we have to see. And, Alex had mentioned it at the very first that, the longer youth stay in the systems, sometimes the less ability they have to live independently. And maybe this is absolutely one of those cases. So does that, previous access to that long-term supportive housing, does that have a negative impact at the end of the day? Or I'd love to see like the lengths of time they were in the TLP and comparatively, but that's for hopefully maybe another discussion. So also exiting from outdoors and emergency shelter to rapid rehousing makes you less likely to return to homelessness. This is incredible too. I think, because we know that it's harder for them to access these to access rapid rehousing. So does that longer wait time maybe increase your self-sufficiency? Does it increase your resiliency? And are those factors in helping you retain housing? So we also see a little less fluctuation in those. So it's more linear, so it's more stable for those exit outdoor and emergency shelters. So there's a lot of questions on this last data set that I would love some input on if you have any thoughts in the crowd, but it was very interesting for me. So on that note, yeah, are there any questions? I guess we'll turn it over. Thank you all.
Great. Thanks, guys. We can go ahead and bring everyone back. Give it just a second for all your boxes to come back on the screen. I want to just pause a minute and thank you all for each pair. I learned something from each of you. There's so many things that I feel like I could follow up with for every single person. But I'm going to start and I'll just ask one broad question. I know there's a few questions from the audience that we'll push out in a minute, but it strikes me that you guys are each in different parts of the country operating within different systems. And I wanted to just hear a little bit more from each pair, thinking about what you heard from other presenters. We have this, what's the continuum like where you are? What Katie talked about in terms of having this youth focus. How, do you use triage tools? What are some of the things that are really jumping out for you in your area that sort of connect what you heard today? So I know you guys could talk on and on. That's a big question, but I wonder if each pair could just share a little about how your area grapples with or the context in your area for some of the things around housing access that were shared in the presentation today. So I'll just go in order of, like, if we could just have Alex and Dimitri weigh in a little bit about what that looks like. It's Richmond, right, Alex? Yeah. So any thoughts, anything that resonated similar, different in the Richmond area from some of these other areas?
Yeah, thanks. Dimitri, do you want me to start or do you want to start?
You can go ahead and start.
Okay. A couple of things that stood out, I think, for us. So we did not, when we first started our work here, we didn't have any youth-specific services. And there actually was a bit of resistance around addressing youth and young adult homelessness. And so a lot of our work was building some of the response, like some of the system level structure that Katie talked about, building it outside of the COC and trying to connect to the COC. So we have a coalition that sounds a lot like your youth committee, and we worked really hard to build lots of youth engagement. We have a really strong level of youth engagement in Richmond. And we then were able to start like having provider discussions, but we've been using that as a way to kind of put pressure on our COC and our system to then respond. So we've seen some slow movement in that, I guess, in that regard. We are not using the VI Spedate or the Next Step tool. And it's actually a question I'd love for us to all maybe talk about. We were part of Away Home America's Grand Challenge initiative in Richmond, and have heard that communities have stopped using it because of increase in racial disparities. And so our community hasn't, again, because we haven't acknowledged that youth have unique needs in the way that we would like for them to. They have not started using a tool, but we would love to see think more about what tool could be useful and what other folks are using. Yeah, maybe I'll stop there. I don't know, Dimitri, if you want to speak to what things look like in Richmond from your perspective.
I think you pretty much covered everything. It's just, I feel like we just need to network more. I think Richmond is a big has a big networking community, but I think there's always more like chance to network more.
Yeah, definitely. Amanda and Katie, anything that like resonated with you guys? I loved hearing about the structure that you have. I think that's really interesting. Anything around triage tools, some of the housing outcome things that others shared? I'll just give you a chance to weigh in.
Yeah, Katie, I'm going to let you answer since you've definitely got the local context knowledge that I don't have quite as in depth as you at this point.
Sure. Yeah, thank you for that question. So I think the biggest thing that has come out of this structure that we're using that we described in our presentation is we were able to apply for something called Youth Homeless Demonstration Program funding put on by additional funding from Housing and Urban Development specifically for youth dedicated housing resources. And so using that strategic plan and that structure, we applied for that funding and we were awarded. We found out this summer we were awarded that funding. So we're very excited. But I bring that up because now what we're planning to do with that funding is execute that strategic plan, but in a way that a lot of the other presentations spoke on. So really designing housing programs, not just funding more beds, funding more vouchers to house youth, but also designing these youth dedicated programs that are going to cater to youth specific needs better and address some of the barriers that we see that youth face. So we're really excited about that with this funding and actually designing these youth specific housing programs. Another thing to speak to the coordinated entry piece that we're really hoping to leverage this funding with is to improve our coordinated entry access for youth. So right now our youth can access coordinated entry just the same as our general population in order to connect with housing resources. But what we're learning from our work with the youth committee and the youth case conferencings is that there's other places that we might be able to connect youth to these housing resources more quickly. So, inviting like our school districts to the table, like I mentioned in our presentation, foster care, and then also criminal justice, youth who have experience with the youth or adult system, criminal justice system. How can we make our coordinated entry access points cater to those places as well so that we can hopefully get youth in and out who are going to enter into homelessness in and out quicker and end their homelessness for good. So that's how we're going to hopefully strengthen our coordinated entry for youth. So yeah, hopefully that answers your question.
Thanks. Eric and Tony, anything you heard in the other presentations that's similar, different, resonates with you, doesn't, in terms of the context in Los Angeles?
Yeah, sure. Tony pinged me and said, can you start this? So I will start this. So I guess I have two thoughts. One is that the scale of homelessness in Los Angeles is staggering, right? I mean, our COC is both the county of Los Angeles and the city of Los Angeles, which is about 14 million people. Our point in time counts so one night of how many people are homeless on a given night in homeless? The last count that we had was about 60,000. There are about 3,000 youth. For example, my friend's place, I've been doing work with them for about 20 years. I've been there on days where there are more than 100 youth at that drop-in center. So like the scope of homelessness that Katie was talking about is the sort of scope for youth is the sort of scope of homelessness that a single agency sees sometimes in Los Angeles, which is just, provides some interesting, the good thing about that is that, which is a weird thing to say that there's anything good about that, is that Los Angeles has been forced to be innovative about how we're doing things. So we definitely were sort of early, adopters of triage tools and those sorts of things. That also means that we've run into problems more quickly. And so I guess the other thing that I wanted to say was that one of the learnings that I've had kind of recently with respect to, as folks start to think about adopting more systematic, tool-driven coordinated entry system processes for youth, is to just remember that the tools that were originally created by me, by org code, by others, typically are thinking about identifying youth who are street dwelling young people who are experiencing homelessness, and what is the sort of history and cumulative impact of the negative experiences of street life, and trying to prioritize them. It was really with a sort of an eye toward large metropolitan urban homeless youth experiences. And so for example, triaging folks out of child welfare systems to try to prevent homelessness, or triaging folks out of school systems to try to prevent homelessness, which is what Katie mentioned just here in the comment. These tools are they're gonna miss everyone that you want to help, because they're going to prioritize the people that are really high acuity. So it's almost kind of like the same problem that we have with youth being given the adult tool, which is what Tony was talking about happening to her fictitious but all too real case, which is that essentially you have young people don't have the same vulnerabilities that adults do. And so if you ask them to score high on an adult tool, they won't, even though they're highly vulnerable. Young people that are highly vulnerable exiting care systems who are yet to experience homelessness won't manifest the same sorts of problems that are captured in these tools, and so you're gonna miss out on them. And so that, I think, is something for us to really think through carefully, and might actually be reflected in some of the results that Shunta and Mark were talking about, right? I mean, if especially in rural situations where these things seem to be not working as well, maybe part of that is because these tools are addressing more urban looking homelessness. I mean, they are tools that were created by human beings with good intentions, but they are certainly not perfect. And you may want to really closely vet these tools to make sure that they're capturing the experiences of the young people that you want to be serving. Because I think that, and I'll end with this, the idea is that these tools are to help us to address the most vulnerable youth. There's nothing sacred or perfect about these tools. So it's my 2 cents as a guy who built tools. Don't take them as gospel truth. Do you want to add anything else to that?
No, I think the only thing I would add is just what resonated was the efficacy of drop-in centers and the necessity of drop-in centers for youth experiencing homelessness. And although there's not a great deal of literature that talks about the efficacy of drop-in centers, we do know that they are effective. And one of the ways is that when youth fall out of housing, that there's a safe place for them to land, so that they're not back on the streets, so that they don't die on the streets, so that they can be connected to services and then hopefully can re-enter into housing. And so that's really what resonated with me throughout all of the presentations, was just that we have to become even more innovative with drop-in centers and other services, so that we can take into account that youth will fail out of housing, particularly youth of color. And what does that mean? How do we provide a soft landing for them? And how do we help them to re-enter back into that system so that they do not die on the streets?
Great, thanks. Mark and Shunta, you guys were able to bring in a little bit, I think there's a little bit of the rural context, not the Columbia's rural, but you guys have people around you that are rural, right? So from just kind of a really different context than Los Angeles, what sort of resonated or feels the same or different for you guys?
I'll pass it to Mark.
Well, it's interesting because, we operate within a balance of state that has 101 counties. So that's our COC. And so when we talk about trying to be innovative and nimble, that's really difficult at a balance of state level. We're in Region 5. So we have one of the, our major, like Kansas City, St. Louis, those areas are their own COCs, and you can really react to what you're seeing around you. But when you're trying to make tools and create policy and things for a wide range of populations and rural areas and just geographic coverage, it's very hard. And so I think, our community here in Columbia has really tried to do its own. You almost have to kind of branch out and do your own thing. But I think we still struggle with measuring, when somebody asks me, like, how many homeless youth do we have in Columbia, I really can't honestly tell them because the structures aren't in place for us to accurately count. We kind of rely on our school systems, and unfortunately they don't have an accurate count as well, just because of the stigma of reporting your homelessness as a student, as a family. So, there's a lot of challenges, and I've loved hearing everything. And, I think drop-in centers, that's our next up on our game, because I think, drop-in centers and moving into housing and having those housing resources right there beside them are incredibly important, and they do show just so much success.
Yeah, if I can add one thing, that's also the need of a drop-in center. We don't have a youth dedicated drop-in center. In the whole area, I think. So that creates an issue in terms of how do we connect youth with services or even housing through connecting them or approaching them with subsistence services. I think that's the part that I heard from all the presentations is highlighting the critical role of youth focused drop-in center or youth space to connect them with housing.
Great. Well, thanks everyone. I could keep going on, but I think there are some questions from the audience that Rania, who has been supporting us behind the scenes, is going to push out. So great. Oh, thank you so much for this amazing presentation, all the amazing information. Thank you, Bobby. We love it. I also want to tell you guys the evaluation link should be pinned on YouTube and Facebook. So make sure you fill that out. That's your mechanism to get CEUs if you want CEUs for attending today. And I think that we asked in there for your suggestions about future webinars. We do hope to do this a couple of times a year. And so looking for your thoughts about topics that would be helpful or relevant for you. So Ashley is asking, what recommendations do you have for COCs to assess the developmental appropriateness of youth and young adult housing supports, tools, trainings, other resources that you might share? You got anybody? I think anybody could jump in. Yeah, Alex. You want to go ahead? I think you can.
Okay, yeah, I just was going to say ask youth. Our young people right now are designing a shared housing program for specific populations that they identified that they were concerned about. We were seeing numbers go up, pregnant and parenting young people, LGBTQ young people, and pregnant and parenting LGBTQ young people. So I think that they know best what young people need. So whether they review or assess program models or part of developing evaluation and looking at the results, or building or designing them from the ground up, that's been our best way to do it.
Mm-hmm.
Great. Others have thoughts on that one? All right, I guess we can move on to another question. Katie and Amanda, what types of challenges have you experienced as you implement this youth-specific model in your counties, and how are you handling those? And I would love just a little background on how long, Katie, you guys have had this structure in place, or like what that process was like to create it. Alex, that probably kind of connects to what you guys have done in Richmond. You know, you can ask youth when you have a really strong youth partnership in place. But that in and of itself is really a challenge to scale up. So in some ways, like building the youth, the capacity, the supports there, getting you into the system, while also building this youth specific focus in the COC. Like, I'd love to hear, Katie and Amanda, you guys can start out and talk a little bit about how that's worked in your county. But I'm for sure, Alex, I think you guys have had some similar experiences. So Katie, does that make sense? What challenges have you experienced? Kind of what's been the process of creating this?
Yeah, so I can start on that. So I think one of the first questions, or you had asked, Sarah, was what it looked like to create these groups. So I'm going to talk pre and then post-COVID, because pre-COVID, we had a youth committee and a youth action board and youth case conferencing in place. And then when COVID happened and we all faced the challenges that came with it, with, how do we meet and collaborate? A lot of things moved online. Well, there was a pause for a while so that everyone could be kind of in emergency response mode. So we stopped a lot of our meetings. But then when we got them going again, we kind of had to start from the beginning and bring people to the table, and do it virtually. And so that worked well for our service providers. So the youth committee and the youth case conferencings, because our service providers have access to technology. They were used to now meeting online. But the biggest hurdle, I think, in the past 2 years has been figuring out how to bring youth to the table in this new post-COVID world where we have hybrid meetings, or, we might still be hesitant to meet in person. How can we still incorporate their voice? And it not just be, a once a month meeting how do we make meetings accessible, and how do we make sure that we're giving them a seat at the table that also accommodates, the access they have to different things, and making meetings accessible. So that's been a challenge, but we are, I think that we found that meeting youth where they're already at to host meetings is really helpful. So, a lot of our youth will go to our day shelter during the day. And so hosting meetings there and just meeting them where they're at, we got a lot of good turnout that way. I think the other big challenge that we faced is just lack of resources. So lack of actual housing and rental assistance dedicated to youth to actually implement the plans that we want to end youth homelessness. So that's why we were very excited to apply for and receive that Youth Homeless Demonstration Program funding, because it's the first time we've ever had funding dedicated to youth that must be used for youth and not just the general population at large. So yeah, we're hoping to kind of conquer that challenge as well with this new funding. So thank y'all for the question.
Great. Alex, is there any tips you have for building that youth capacity, or, sort of ways to really be able to develop that structure where you can go ask youth and get them co-creating or leading these initiatives? And Dimitri as well.
Yeah, I was going to say, I'm curious, Dimitri, what you think about what's working for us. I mean, I think that we're like 7 or 8 years in, and now it's much easier. I know that Dimitri and I were just talking about how now young people are coming to us and asking when and how they can get involved. So that's a lovely space to be. And we also have had interesting impact of COVID in that moving online, while it was really hard, a lot of our young people actually found it more accessible, and we had more participation in our coalition meetings. I think the relational piece, like Katie was talking about, I think a lot of our young people like meeting in their youth specific meetings and being connected to each other, and that relational piece got lost when we went online. And so we've been trying to get really creative about making sure that we keep that component, and having to get real creative about how to have meals together, or just be able to connect in outside spaces. Dimitri, what are your thoughts about what other communities can do to build strong youth leadership?
I'd say the most important thing that comes to mind to me is just valuing the lived experiences of the youth and valuing their expertise when they do bring their ideas to the table. Because a lot of youth that do come to tables and they do speak and they do bring their expertise, it's mainly just, in my personal opinion, is payment. Is a lot of youth that do what's the word I'm looking for, that do show their lived experiences and give their ideas, are often compensated in just gift cards. And that is not how we should be valuing our youth. They should be getting paid for their lived experiences and for their advice just as much as anyone else does. So that's my piece on that one.
Great. Well, I know we're like almost out of time here. I'm hearing a lot of things and around like potential avenues. And I know that we may not get to your questions. If you have suggestions for us about future webinar topics, please go ahead and put those in the chat. I think also the evaluation will ask, but love to hear some of that. I think I've gotten through comments that have come to me, and also what I'm hearing, some ideas, people wanting to hear more about prevention, how we can, sort of start earlier, further upstream. I also heard overlap or echoes across presentations around mental health, around certain populations, such as youth that are aging out of foster care. So I think I have some great ideas about what we could focus in on. I think for future sessions, it was wonderful to have people from all over the country weighing in and dialoguing about this. So thanks to everyone for your participation in that. And I think there's lots of sort of special things we could dive into in future presentations. So please take a minute to fill out the evaluation, give us your thoughts, and I hope look for our next Research to Practice webinar, hopefully in 6 months or so. That would be our plan. Any last thoughts from the panelists? All right, great. Well, thanks to you all.